In this video, I'm going to walk you through the major veins that bring deoxygenated blood into the right atrium. Obviously, we focus on the ones that this model shows. First of all, I know that coronary sinus is the vein that collects deoxygenated blood from the wall of the heart and empty that blood into the right atrium. But in this video, mostly I focus on those veins that empty their blood into the superior vena cava and inferior vena cava. Let's start with the superior vena cava. I see two veins empty their blood into superior vena cava. Basically, when these two veins join together, superior vena cava forms. We name these two veins brachiocephalic veins. And I see that each brachiocephalic vein forms when internal jugular vein and subclavian vein fuse together. Recall, subclavian vein drains deoxygenated blood from shoulder and upper limb. Internal jugular vein is the one that drains the oxygenated blood from the inside of the cranial cavity. Also, I can see veins such as superficial temporal vein and facial vein. They all empty their blood into the internal jugular vein. And when I follow internal jugular vein, I see exactly in this spot, it fuses to subclavian vein. And as soon as these two join together, the rest would be brachiocephalic vein. That's the left brachiocephalic vein, and that's the right brachiocephalic vein. Unfortunately, we do not see the external jugular vein in this model, but if you have the external jugular vein in a model, it should sit lateral to the internal jugular, and external jugular empty its blood directly into the subclavian vein. Now I follow the subclavian vein to see it receives blood from which other veins. So I have to focus on shoulder and upper limb. First of all, in this model, the veins that I see in the upper limb are superficial veins, the veins that are closer to the surface. Since brachial vein, ulnar vein, and radial vein are more deeply located, I really don't have a view of them. The only part of brachial vein that I have in this model would be the end of brachial vein, exactly where it empties its blood into the axillary vein. And then axillary vein continues and forms subclavian vein. So let's see what are the superficial veins that this model shows. I see a lateral vein and a medial vein. Both of them are very long vein. Both of them start above the wrist. The medial one is called basilic vein. The lateral vein is called cephalic vein. So I move toward the wrist and I see exactly above the wrist, cephalic on the lateral and basilic on the medial start, and you can follow each one of them. Cephalic goes up, and here it also receives blood from this tiny vein that is called accessory cephalic, and then it goes all the way up, and when you follow cephalic, you see that eventually it empties blood into the subclavian vein. And the story repeats for basilic vein. Above the wrist it starts and it goes all the way up and eventually empties its blood here near the area that brachial vein comes. But for now, I want you to pay attention to the front of elbow because something very important is going on here. I see that there is a vein that connects basilic vein to cephalic vein. This is a very important vein for health professionals. It's called median cubital vein. This is the vein that commonly is used to either inject a medication or for blood transfusion or to take a blood sample. So don't forget about the median cubital vein connecting basilic to cephalic vein. So these are the veins that I see that all of them eventually drain their blood into subclavian vein. Now I Do not discuss the blue blood vessels that I see in the thoracic region, because these are not veins. Recall that's pulmonary trunk, which is an artery, and these are pulmonary arteries. So I move down and focus on the veins in this video, including inferior vena cava. So inferior vena cava starts here, and then it goes all the way up to the right atrium. I see below diaphragm, I have several hepatic veins. They bring deoxygenated blood mostly from the liver. And then when I go down, I notice another vein that is also very important for health professionals, and it's called hepatic portal vein. I see that hepatic portal vein sends deoxygenated blood to the liver. Please keep in mind the blood that flows through hepatic portal vein is deoxygenated. Liver receives oxygenated blood through common hepatic artery. And as you can see, common hepatic artery and hepatic portal vein sit very close to one another, but these are two different blood vessels. How does hepatic portal vein form, and what is the importance of this vein? First, to form hepatic portal vein, I have to focus on splenic vein, the vein that drains the oxygenated blood from spleen. Recall that spleen filters blood, cleans blood. Also, the oxygenated blood from part of stomach and pancreas are released into splenic vein. When I follow splenic vein, right here, I notice inferior mesenteric vein also empty its blood into splenic vein. Inferior mesenteric vein brings the oxygenated blood mostly from the second half of large intestine. So basically, from the second half of large intestine, inferior mesenteric collect blood and then empty the blood into splenic vein. And then when you follow the splenic vein, exactly here, you see that splenic vein joins superior mesenteric vein. Superior mesenteric vein collects blood from most of the small intestine, the first half of large intestine, stomach, and also pancreas. As soon as superior mesenteric vein joins splenic vein, the vein that they form together would be hepatic portal vein. And then we see that left and right gastric veins that bring the oxygenated blood from the wall of stomach also release their blood into the hepatic portal vein. So, following the veins that form hepatic portal vein, those are superior mesenteric vein and splenic vein, and knowing the fact that inferior mesenteric empties blood into splenic, and also left and right gastric veins empty their blood into hepatic portal vein, clearly hepatic portal vein send a deoxygenated blood that is full of nutrients that we absorb mostly in small intestine, and also some nutrients will be absorbed through the wall of stomach and large intestine. So we can see that liver cells have the first shot. They receive the newly absorbed nutrients through hepatic portal vein. They store the nutrients that they're supposed to, they modify some, and they produce some new products. Also, they detoxify toxic substances, and eventually blood from liver will be released into hepatic veins that take blood into inferior vena cava. Please keep in mind, since in the United States, most drugs are taken orally, and the absorption of those drugs will happen in the digestive system, including stomach, small intestine mostly. Clearly, the first organ that receives those drug molecules will be liver due to hepatic portal vein. So that's the importance of hepatic portal vein. Then when I go down, I notice the two renal veins. They bring the oxygenated blood that has been filtered and cleaned in kidneys to the inferior vena cava. Unfortunately, in this model, we don't see the gonadal veins either. However, if you have the gonadal veins in a model, it's interesting that we notice that the left gonadal vein empties blood into the left renal vein. However, the right gonadal vein empties blood directly into inferior vena cava. So in theory, we can go through them. Now I go down to the beginning of inferior vena cava, which forms when the two common iliac veins fuse together. And I know that the two common iliac veins, basically each one of them receives blood from internal iliac and external iliac. Internal iliac veins collect blood from especially the organs that we have in the pelvic region. External iliac vein collects blood from the lower limb. So I focus on external iliac vein because I have a better view of that in this model. When I move down, I notice that I have femoral vein. That's femoral vein. And when femoral vein penetrates the abdominal wall and enters the abdominopelvic, then we change the name and we refer to it as external iliac vein. So the question is, which veins empty their blood into the femoral vein, and then femoral vein brings blood into the external iliac, and then external iliac takes the blood to common iliac and eventually inferior vena cava. So we focus on femoral vein. I notice femoral vein receives the oxygenated blood from many of these deeply located veins that we actually call them deep femoral veins. Also, femoral vein receives the oxygenated blood from this long vein. This is literally the longest vein that human has. And to see the beginning of this long vein that is called great saphenous, I have to go above the foot. So I go all the way down to the distal part. Above the foot, I can see the beginning of great saphenous. Recall, great saphenous is in the medial side. But I also see another vein laterally located. That's small saphenous. So one by one, we focus on these two. I start with the medial, the great saphenous. I follow great saphenous. I see it's really the longest vein that we have. It goes all the way up and releases its blood into femoral vein. Then I go back down and focus on small saphenous vein. I follow small saphenous, and somewhere here I no longer see the rest of it because small saphenous goes behind the bones. And then when we get to the knee region, exactly behind the knee in popliteal fossa, small saphenous releases its blood into the popliteal veins, and then popliteal veins empty their blood into femoral vein. So eventually femoral vein also receives blood from the small saphenous. And as I mentioned, when you follow the femoral vein, you eventually enter the abdominopelvic and turn into external iliac and internal iliac join, common iliac forms. And when the two common iliac join together, inferior vena cava starts, which takes blood up, receives the oxygenated from many organs that I discussed, and eventually empty blood into the right atrium.